Welcome back, everybody. So the Government Employees Medical Scheme, that's GEMS, will tomorrow bring together industry leaders to engage on the future of healthcare in South Africa. This medical aid scheme represents over 754,000 who form a large part of frontline workers in the government sector. Now, the symposium comes at a time where South Africa appears to be lagging behind in its queue to vaccinate at least 65% of the adult population against COVID-19. A major discussion point will be what the country can learn from other countries to ensure effective rollout of the vaccination, as well as some of the hurdles, wins and lessons to be learned from the country's vaccine procurement to date. Dr. Stanley Moloabi is the principal officer at GEMS, and he joins us now to talk about it. Good to have you, Doc. Thanks very much for being with us.
Good morning, Leanne, and good morning to the Morning Live viewers.
So let's start off here. We obviously, as I mentioned in the introduction, you represent about 754,000 employees, government employees. A lot of them are frontline workers. How many to date do you know of that have been vaccinated in the Sisonke trial?
So the first phase of the vaccination rollout involved vaccinating the healthcare workers who are patient-facing. And as at yesterday, we are over 400,000 of the healthcare workers have been vaccinated as part of the Sisonke. It is not only those who belong to GEMS, it is a mix of those who belong to GEMS, those who are not members of GEMS, and maybe some of them are actually not even belonging to any medical schemes.
Yeah, okay.
So that's where we are at.
So there's no, I mean, obviously we know it's not just for GEMS, but there's no specific data that you have available to you as to how many of your members have already been vaccinated due to this?
No, not at the moment, because we're still working behind the scenes to how we can receive data from the EVDS system, which is solely at the moment run by the National Department of Health.
All right, fair enough. So let's talk about the symposium, a very important symposium, no doubt. Who is taking part and what are you trying to achieve with the symposium?
So we have organized the symposium as GEMS because it's an annual event that we have. This is the first virtual symposium. We have co-organized it with the BHF, the Board of Healthcare Funders, and the participants are really policymakers. We have the Deputy Minister of DPSA as the employer, the Honorable Sindisiwe Chikunga, who will be opening the symposium for us. And then we have the chairperson of the Board of Trustees of GEMS, Dr. Mili Hlaswaya, who will also be one of the main speakers. Then we have experts from the various parts of the healthcare sectors. So we have business representing those that are involved in the vaccine rollout. We also have from the CDC, Dr. Omar, who will share with us, you know, what are the experiences from other countries. And then we have even medical scientists who will look into some aspects of research relating to vaccine rollout. Mm.
But obviously, you know, it's no secret. We do know we're watching many of the other countries, developing world, and also not necessarily those that are, you know, way above us financially, but those that are our equals as well, have been vaccinating at a much faster, robust rate than we have, and that, you know, we do know this. Does it concern you that we are lagging so far behind in the vaccination rollout?
Well, I mean, I wouldn't say I'm not concerned, but I think it is important for us to realize why it happened. We know that we could have been far ahead if we didn't have, you know, what happened with the AstraZeneca. We had 1 million doses, but we could not use them because of the emergence of the variant in South Africa, which at that time was, it was said that the first batch that we had was not as effective as it is desired. So that was the first hurdle that we, you know, took us a few steps back. And then we do know that in terms of just acquiring the vaccine, the entire world is faced with this vaccine equity issue where it is possible that some of the first world countries have actually acquired more than they should be acquiring. And this has been said even by the WHO that there is a need for us to distribute, to have the their vaccine distributed equitably throughout the world. So the main problem has been with acquiring the vaccine. But the minister has announced now that the agreements are in place, and we are hoping that, with the batches that are anticipated to come in the coming few weeks, we will ramp up, and the vaccination program will be much faster. Yes, we are behind, but I'm really hopeful and positive that we will catch up.
Yeah, I mean, gosh, we even hear stories coming out of America where 12-year-olds are now starting to be vaccinated in the US, and some of the most vulnerable citizens of our country, they don't have a clue what's going to happen. I mean, we've got the supposedly having phase 2 rollout next week, and yet people are still in the dark. Are you hoping? Do you have more clarity than we have as normal South African citizens sitting waiting? We've been told to register on the system. More than that, we don't know. We don't know where to go. We don't know how it's going to work. We know nothing. Do you think a little bit more information will emerge out of the symposium?
Well, the information that we're trying to get out there, and we will definitely talk about these things at the symposium. Firstly, it could be that everybody believes that there is paucity of information. But I think the information is there. And when you look at the Department of Health website, there's quite a lot of information that relates to vaccination. And the main thing is that once you register, and so we know that for phase 2, it's the over 60-year-olds and the essential workers who needs to register. We all need to register on the EVDS. And once you register on the EVDS, then a message will be sent back to you to confirm registration, at which stage you need to wait for when you are allocated, when you need to go and receive your vaccine, and at which vaccination point. I mean, that is really the basic information that you need, and that information is available. What we are concerned about is that people are not registering at the rate at which we expect them to register. And I think that is the most important thing we need to do.
Yeah, I mean, I know that there is a big call out for those over the age of 60 to register and make sure that they're on this list. But hopefully, I mean, this rollout is meant to start from Monday next week. That's the 17th of May. That's when it's started. What role are you going to play when it comes to this? I mean, I know that GEMS have said that you're ready, you're waiting, you're prepared to help in any which way. Yeah. Do you know a role as yet that you are going to be playing?
Yes, we have held a lot of meetings, planning meetings, with the Department of Health, and the Department of Public Service and Administration is the employer. And then we are in work streams that have been set up as part of the bigger vaccination program, and that the work stream that GEMS is part of is the workplace-based vaccination program. What that means is that we will be involved in the vaccination of public service employees, both those that belong to GEMS and those that do not belong to GEMS. As long as you are a public service employee, we have partnered with the Department of Health to assist in the rollout with respect to public service employees. So that's really the role that we will play. So we are involved in the logistics of the vaccination sites relating to the public service employee.
Yeah. How confident are you that we're going to run this efficiently? I know that there's, obviously going to be lessons learned from other countries like Israel, Bahrain, those kind of countries that have managed to, vaccinate a large portion of their population. You're going to learn lessons there, things that we've seen happening during Sisonke trial. Also cold chain management, because now administering Pfizer is going to be a completely different ballgame, trying to keep the temperature right and all of those logistics and the administering of it. I mean, there is so much happening behind the scenes that, us normal folk that are not involved in it are not even aware of. I mean, are all of these kind of things, are you confident that the rollout will go smoothly?
When you are faced with a task as big as this one, and you haven't done it before, I think it would be naive for one to be confident, overconfident. I think we have to approach this in a careful way. Now, we've done a lot of planning, and based on the planning that we have done, we need to ensure that we give it our best shot, because we know how important this program is. So I cannot talk about being overconfident, but I think I am positive that we will deal with this rollout in an appropriate manner based on the planning that has been, that has been put in place. We have a lot of vaccination sites that I think it's over 3,000 vaccination sites throughout the country that have been put together by the National Department of Health that have been accredited. And there's probably still more to come, because there are discussions, on how private individuals like GPs and pharmacists will have their sites accredited. So it's still going to be bigger than it is at the moment. And we just need to give ourselves, I don't think we should be too tough on ourselves, but we should give it our best. We should give it our best.
Yeah, I have to disagree with you. I think we need to be hard on ourselves. We need to be so hard on ourselves that we get this going faster, because we need, there's the threat of a third wave. There's new variants in the country. We're going into the winter months. The cases are rising. So I think we need to be very hard on ourselves to make sure that this happens very, very fast. Just before I let you go, there's also a question that many have been asking, and I think it comes from government's side, saying that they want to be the ones that are procuring all the vaccines. But many are asking, why can't medical aids procure these vaccines and give it to qualifying members? I mean, it seems like a thing that would work. Is that still under discussion? I mean, do you possibly see that happening going forward?
Leanne, let me clarify my role in this. So in terms of those type of decisions, so I would say I'm a technocrat. I implement policy. The policy is decided at a different level from where we're operating as a medical scheme. So while I think that what our views are in these things can be taken into consideration, but I think that really is decisions that the government takes. We are a medical scheme. We do funding. We involved in the logistics of ensuring things happen. At the policy level, I think that is above me, and I wouldn't want to get into that discussion.
I understand the sensitivity around all of this, but I'll tell you what, let's hope a lot comes out of this meeting. Do you, as far as you know, will it be broadcast? Do you think that a lot of people will be? I know, because the health minister may be a part of it, so I'm sure that some broadcasters will dip in and out, and we can get some of the key things coming out of it.
We have 14 media houses that have indicated that they will be part, but we don't have confirmation of live broadcast yet. From the Ministry of Health, we will have the DDG, Dr. Anban Pillay, representing the minister.
Fantastic. We look forward to it. Thanks for talking to us, Dr. Stanley Moloabi. He's the Principal Officer at the Government Employees Medical Scheme, or GEMS. It's talking about their role in the COVID-19 vaccine rollout and this upcoming symposium that's going to discuss the future of healthcare in the country. All right, let's have a quick break here on the program, and when we return, headlines and sports news. Do stay tuned.